part 2 of what was supposed to be a part 1. That's what happens with your French in Italian. You like to speak. Okay, so wound healing. So I'm gonna try to make it, because wound it's very complicated. Like I said, it takes different courses and stuff to kind of even understanding and how it heals and everything. But I'm gonna try to represent it and to make understand what wound is about. The first thing you need to understand is there's a separation between two things: wound closure and wound management. And we're going to talk about wound management here, not so much wound closure. So wound closure would be using of staples, steri strips, and suture, staples, steri strips, all those things where you close your wound. And this is a totally different topic, because it's certain wounds that you need to close in different ways and different things. And that's not what I'm interested in talking about. I'm more interested about wound healing and wound management. So to show that, I brought a little container. And so imagine that, so we have different layers of skin, and I'm going to put a picture of what the layers of the skin looks like. And so, as you saw from the pictures, when your layers happens, depending where you are, you can have superficial wounds. So, for example, what we call road rash or laceration, or road rash mostly. So your skin or skin tears, and it can be superficial, and you can have deep wounds. So, for example, a puncture wound would be probably one of the deepest one, because you're really deep. So, for example, skin. So, for example, this imagine is your skin, and this is the other layers of your skins. So, for example, a road rash would be just this removed, but your skin remain full. And a puncture would be where my finger is, so basically all deep like this. And so, depending on where your wound is, treatment will differ as well. And again, further treatment will further videos will explain more about treatments and everything with experts and everything on all the different wounds. But just want you to understand what a wound is, and why is it so important, and some of the products that we put in or not put in. So when we talk about wound healing, it's a little bit, the analogy that I like to talk about is a freezing lake. So imagine that this is a lake. Well, it's a container, it's a wound, it's everything. Use your mind. Use your mind. So, frozen lake. So that's what happened when you work night shifts. So frozen lake. So a frozen lake, the water in the summer is warmer here because of the sun hitting, and then the water is over here. And naturally, it's another thing on lakes too. So when the lake freezes, the water here, the gradient of the water needs to change before the ice start to form on it. And then when that gradient, when the water gets colder, when it gets colder over here, then the ice can form over here. Well, wound is the same thing. You want a wound to heal from bottom up, not from side to. Because imagine, for example, analogy of the lake again, that you have your ice just like this, but your lake is not full, or it's not fully cold, and there's not a lot of, well, every time, as soon as I'm going to put pressure on, I'm going to close. And so this is what happens if you close the wound prematurely, or the wrong type of wounds. Because if, for example, you suture a wound that needed a little bit more healing, or then you just close the skin. Looks nice on the outside, looks like it's all beautiful and everything, but actually there's a big gap on there. And any pressure, shear, compression, trauma to it will literally just re-break your skin. Oops. Re-break your skin and basically create your wound will kind of collapse again. So what you want is fill your wound from the top down, so that now when you put your wound on, it's filled out, so it's stable. So for example, I don't know if you'll be able to see from here, but I got a wound here on my elbow, and you can see, oh actually yeah, you can see it pretty good. Well, pretty good, not bad. Right over there's like a scar. And on that wound, I never put suture or anything like this. I felt rollerblading, and all I did was putting different product. At the time, what I had was some gel, and I fill out, and basically what the gel does is, that's what it does, it fill out my wound and creating the right bed. Because when it comes to wound healing, it's a little bit like the 3 barriers in French is boucle d'or. I forgot the name in English, I'll put it in the bottom, but it's the right bed, not too big, not too small, the right size. And it's always the same thing with the wound healing, is you want to have the right medium, the right container, the right wound bed for the healing to happen. Because right from the periphery of your wound, epithelial cells, which is basically what your skin is made of, will be there. And if the ice, again back to our lake, if the ice is not strong enough, they won't go across. They won't create this bridge that's gonna slowly decrease the wound size and then create this straight. Because they're like, I'm not leaving this bed, I'm not safe on this ice. But if they feel the ice is thick enough and it has the right thing, it will go across. So it's really important to create the right thing. And there's some products, like for example, if you put alcohol, everything, it is what they call cytotoxic. So basically it can create more inflammation or also more irritation to the inside of your wound, or delay that filling of your wound bed. And now what happened is that you just delayed your healing. So for example, peroxide, which a lot of people say, oh, you can use it. Well, the bubble that it does is basically oxidation that breaks down your clot that you just formed. And so sometimes a scab is good for that, because it protects the wound to keep that perfect beds inside the things. And by breaking that up, you keep reopening it up. And so, like for example, at the hospital, we use peroxide to clean dry blood. So if people have come with a trauma and they have all that in their face, that's where we clean their face with, so that it cleans. So peroxide has their value for that. But again, in some of the literature that you may see, they're starting to say, well, maybe for some type of wounds, but this is way above me and you will feel in the field we're talking about, because when it talks to wound as well, we have 2 categories. So first of all, we were talking about wound closure versus wound management, but now there's a second category, acute wound versus chronic wounds. And the chronic wounds, it depends more, it's not so much that it's been on for 3 or 4 months, but it's more about where is it in the process of healing versus an acute wound. So if you have just cut myself, you're mostly an acute wounds because it just happened now. But depending on what's going to happen with the stuff, it can become chronic in 3 months. It could become chronic in 2 days. So it depends on where is it on the chronic stuff. And so in the next segment, now I just see we have another third. Looks like it's going to probably be a 4th segment now. In the next segment, we'll start talking about that, so stick around.